Hello, my name is Jada Story, and I work in the Department of Interprofessional Practice and Training. Today, we will discuss mentation as it relates to delirium and what interventions you can perform during your clinical rotations to help our older adult patients stay intact with their thinking and ability to reason, and also what you can do to assist patients who may be cognitively impaired. Let's start with talking about why specialized care is so important for older adults. As you have learned about in previous videos, the population 65 years of age and older is growing at an alarming rate. This population also experiences many age-related changes that diminish their reserve capacity, which results in changes in their body systems, such as the cardiovascular, pulmonary, renal, GI, musculoskeletal, and nervous system. They are also more at risk for changes in their cognition and often present with atypical presentation of a disease. Because of these age related changes, their care becomes complex, and statistics actually show that an older adult's health often becomes worse during hospitalization. So, what does all of this mean? It means that older adults are vulnerable to many negative outcomes during hospitalization, and therefore they cannot tolerate just usual care. Let's take a look at the picture on the left. This person is functionally and cognitively intact. Therefore, if they were in the hospital, they would have plenty of room to spare. This means that if they got a UTI while in the hospital, they would recover and probably be just fine. However, let's take a look at the picture on the right. This is an example of what an older adult looks like in the hospital. Because of all those age related changes we discussed on the previous slide, they are already at the top of their mountain. This means that they have no room whatsoever for error. The development of a UTI, or maybe just not getting out of bed for 2 days, either of those could be the one thing that sends that patient over the edge and spiraling towards negative outcomes. And we never want this for our patients. Therefore, specialized care is needed for this vulnerable population. So at UAB Hospital, we have become an age-friendly health system, which you all learned about in previous videos. The Institute for Healthcare Improvement, or the IHI's Age Friendly Health System Initiative, is framed around the four M's. So that means, how do we organize care around what matters to the patient, medication safety, mentation, and mobility? And when we address this question, we are essentially providing specialty care. Today, we will focus on mentation. Within the 4M's framework, mentation focuses on the prevention, identification, treatment, and management of dementia, depression, and delirium across the settings of care. However, during the remainder of this presentation, we will focus on delirium and briefly discuss dementia. I'm sure some of you are already asking yourself, what's the difference between delirium and dementia? The biggest differences are their onset and course of progression. Delirium has an acute onset, anywhere from hours to days, compared to dementia, which is chronic and slowly progressive, which can be anywhere from months to years. Another key difference is the patient's attention span. For example, a patient with dementia, they will be able to have a conversation with you. They'll be confused, they may think it's 1965, but they'll be able to have a conversation with you at least until the late stages of dementia. However, a patient with delirium, well, they just can't focus. And that can look one of two ways. One way is hyperactive delirium. And everybody knows this patient. It's the patient that everybody's seen. They're inattentive, they're yelling, they're throwing stuff, they're pulling at everything, and sometimes they may be just talking to people that are not there. But then there's also hypoactive delirium, which sometimes gets overlooked. And this is that patient who just can't keep their eyes open and they're sleeping a lot. And I'm not talking about the patient that's in a medically induced coma or in the ICU. Another question you may have for yourself at this point is, well, can a patient have dementia and delirium at the same time? And the answer to that question is that they absolutely can, which is why we want to be aware of the differences in presentation between delirium and dementia. So, in summary, Think about delirium as being reversible and dementia is not. So, why is it important that you are aware of delirium and how is it reversible? So, when I think about delirium, I think about a red line in the sand. Anyone can become delirious, but older patients are more at risk or closer to that red line than younger individuals. So, some people are really close to that line and others are really far away. And what happens is that we do things in the hospital to push you towards the line, such as keeping you in PO for a test that you may or may not have, or because of that, you get dehydrated. You may have a little pain, so we give you some narcotics. And then we don't want you to fall, so we tell you to stay in bed. And then you wind up getting an infection. So the bottom line is that we should try to push our patients away from the line using interventions such as mobility, cognitive stimulation, and even orientation. A key point is that delirium treatment is all non pharmacological, and the same interventions that we use for treatment are actually the same interventions we use for prevention. So let's talk more about what you can specifically do during your clinical rotations to prevent patients from developing delirium or to assist with the management and treatment of patients with delirium. So again, their interventions are the same for prevention, management, and treatment or delirium. Here are some of the interventions that you can perform with your patients during your clinical rotations. You can do things as simple as cleaning and straightening up your patient's room. And while you're doing that, you can turn on the lights, you can open the blinds, and this will actually help to orient your patient so that they can distinguish days from nights. If your patient is mobile and it's okay with the nurse, you actually can walk with your patient in the hallways. You can even fill up your patient's water cups to ensure they stay hydrated as long as it's not contraindicated. If a patient needs help feeding themselves, then check with the nurse and see if it's okay if you help them out. You can do something as simple as having meaningful conversations with your patient. Spend time in their room, strike up a conversation, and maybe you'll be able to find out what actually matters to them. And then always, the delirium prevention toolbox is a good option for you to utilize. So I'm sure some of you are asking yourselves, well, what is the delirium prevention toolbox? Well, the toolbox contains items to help prevent delirium and manage the delirious patient. So let's talk about what's all inside. There are items for cognitive stimulation, such as magic cubes, crossword puzzles, word finds, coloring sheets, card games, and there are even brain exercises in a booklet. There are also items for distraction for the patient, and this may be for patients who need pain management or for the patient that's pulling at lines or just plain bored. You could use the items that I previously mentioned, or you could also use teddy bears, stress balls, or even tangles. There is also a pocket talker in the toolbox, and this can be used for those patients who have hearing impairments and maybe they don't have hearing aids. And then there's also resources for you, such as education on delirium and a delirium handout that can be given to the family of the patient. When you get to the unit, just ask your clinical instructor or the nurse where the delirium prevention toolbox is located. So, to wrap up and in summary, it is important that older adults receive specialized care. The specialized care that older adults receive at UAB is centered around the forums framework. Remember that delirium is one of the four M's, and therefore, delirium prevention interventions should be implemented to prevent delirium and manage and treat the delirious patient. Everyone plays a critical role in making sure our patients do not develop delirium during their hospital stay, and everyone includes you. Remember, you play a very, very important part of our patient's healthcare team. And with that, I would like to say thank you for taking the time to view this video. If you have any questions, please follow up with your clinical instructor. We look forward to seeing you on the unit. Thank you.